So I'm Jessica. I am with Pickering Public Library. I'm also joined by Becky and Claire in chat with the library as well. And tonight we are amazed to have two naturopaths from Durham Natural Health Center. This presentation was supposed to happen face-to-face at the library, and they graciously joined the call for us, so they're doing the presentation online. So amazing that you could join us through Zoom and still continue with this presentation for our clients, because stress is something that I think we are all aware of right now and very timely. So this was absolutely perfect. So we have Dr. Nicole Sandilands and Dr. Natalie McCulloch here, both from Durham Natural Health Center. You guys co-founded the health center. As naturopaths, they have it's a pretty big practice with different RMTs, everything like that. Both of them have done their kin degrees through McMaster before becoming naturopathic doctors. So amazing that you could come here virtually tonight with us. So thank you for that. And I will turn this over to you so you can start your presentation.
Great. Well, thank you for the introduction. For those of you that are looking at your screens and kind of looking back and forth and going, are they not? We are twins. We are identical twins. And we opened this clinic together. It'll be 8 years in August. And so we love to give presentations around the community, and we've done a few at the library. And so this is a great, exciting opportunity for us to be doing it virtually. So
and didn't realize this was the first one. So this is great.
Yeah,
this is really
even more exciting. And when we decided about topics, we decided to talk about stress. And so now more than ever, I think this is incredibly, incredibly relevant. So what we're going to do, we're going to talk about a little bit about what is naturopathic medicine. So who are we? What is it that we do? We're going to talk about stress and the facts around stress. We're going to talk about the different phases and types of stress. We're going to talk to you about your adrenal glands, which are the glands that produce cortisol, so your main stress hormone. And once we give you all those facts, we're then going to tell you about what we can do about it. So how do we make a change? How do we make some improve your stress overall? So what is naturopathic medicine? I think when people, it's changing a bit now, but I think when people come to learn a little bit about naturopathic medicine, there can be some misconceptions. And so I think sometimes people think they might see something that looks a little bit like this. And we're here to tell you that's not really the case. As was mentioned, what Jessica mentioned, we both have done a 4-year undergraduate degree in kinesiology before continuing and doing 4 more years of medical studies in naturopathic medicine. So by the time somebody is licensed and regulated in the province of Ontario, they've done at least 8 years of post-secondary education. And we are trained very similarly to your family GP and the way that we approach and assess illness. So we can do blood work and physical exams and ask all the testing to arrive at a diagnosis. Some of the differences might lie in a couple of things. So one, our visits tend to be longer. We spend up to an hour with patients. We're talking not only about their main reason for coming in, whether they say, oh, my elbow hurts or I have headaches. We're also trying to understand everything that's going on with them. So you'll get a sense of that as we talk a little bit more in the presentation tonight. But I think it's important to understand that the reason that stress is such an important topic and something that we wanted to discuss tonight is because we talk about this all the time, and it's rooted in a lot of different health concerns and a lot of different symptoms that people might be experiencing. So some of the different treatment options that we utilize in practice, I'll just kind of go through this briefly. Herbs, we can use nutrition, intravenous therapy, so vitamin and mineral infusions is something that we use quite commonly in practice. We use this a lot for people who are burnt out, tired, exhausted, chronic migraines, hormone imbalances. I mean, you name it, we use it for a lot of different conditions. Acupuncture is something we can do as well that we do pretty routinely in practice. It works great for things like insomnia and anxiety, that type of thing.
Not now, obviously.
Yeah, no, we can't either. Those the last two I mentioned are irrelevant these days. We're doing everything virtually right now, which is again a new thing for us in our practice, but seems to be working out really well. We've been helping a lot of people with their stress, their anxiety, their insomnia, some of these different things that have been coming up. But some of the different things that we treat in practice are a lot of digestive concerns, immune issues, so things like autoimmunity, pediatrics, we see a lot of kids in practice. So a lot of, recurrent ear infections, or kids who are like chronically getting sick, and the parents are like, what do we do to support or boost their immune system? We do a lot on that. Skin conditions, high blood pressure, cholesterol issues, and adrenal fatigue, which we'll talk about tonight, thyroid issues, stress management, anxiety, depression. These are all things that we treat often. And stress is always a piece of that when we're talking about that. And then women's health is something that we both have a pretty strong passion for, that we see quite a lot of in our practices. So helping women to balance their hormones, helping people to feel like themselves again, balancing energy, helping people sleep, that type of thing. So that's a little bit about us, and we'll sort of dive into the stress stuff right now.
Yeah, so let's sort of talk about why we are all here tonight, collectively, sort of virtually, which is so nice. It's, I saw that there's 40 something participants. I'm like, oh wow, it's been nice to sort of connect with that many people. It's been a while. So I think that this is like super timely that this presentation is still going on and that we are able to do this virtually. We were doing this sort of pre-COVID life, pre-pandemic life, but I think now more than ever, people are experiencing a significant amount of stress. It's not uncommon in sort of the regular world for people to just say, oh, I'm so stressed out, I'm so busy, I have so much going on. But I think now there's sort of this new level of anxiety and stress that's sort of like permeating through our society, given sort of the climate of what's going on. So I'm excited that we can talk about it and hopefully leave you guys with some tips and strategies on things that we can do to help with some of the stress. So I wanted to talk a little bit about, there's some new research that's come out of China. So there was current research out of China that studied the immediate psychological response and associated factors during the initial stages of COVID-19 in the general population. And they noticed that 53.8% reported the psychological impact of the outbreak to be moderate or severe. 16.5% of people reported severe depressive symptoms, 28.8% reported moderate to severe anxiety symptoms, and 8.1% reported moderate to severe stress levels. So we can see that obviously this is having a humongous impact on people's mental health. So I'm hopeful that we will leave you guys with some tips and strategies on things we can do today. So, why is stress important? And this is sort of, why is this important in every day, and why is this even more important today? So this is sort of a percentage of people who are reporting that most days are quite a bit or extremely stressful. They looked at it based on age group, sex, household, population of people 15 years or older. And you can see that the age group that reported sort of the highest amount of stress was the age group that was sort of 35 to 54. So we can probably extrapolate that to maybe the working population, maybe people who have, children still at home. And then generally speaking, certainly in the 35 to 44 age group, women reported more stressful symptoms than men. So this is another thing, looking at sort of over 1/4 of working adults said that their lives are very stressful. So if we look at this, sort of 46% said they were less stressful, 27% not stressful, and then 27% also said highly stressful. So this isn't just like a little bit of stress. This is quite a significant amount of stress. So, we talk about stress, but like, what is stress? We talk about it all the time. So what does that actually mean? So this is a chemical response from the body. And we're going to talk a lot about sort of our adrenal glands and what those are, but these are sort of like, there's chemical messengers or chemicals that are hormones that are sort of released into our bloodstream, and then our body has to respond to that. So these have abilities to, increase our strength, increase our concentration. Stress in the short term can be quite protective, and it's something that is good for the body. But when it goes into sort of the long-term stress, this is where we get into a little bit of challenges. So I wanted to start this off with like a little bit of a quiz. So I wanted to, if all of you can you're going to answer yes or no. There's 20 questions, so we'll go through them pretty quickly, but I wanted you to answer yes or no to these questions. So we'll go through these. So, and then we're just going to kind of get an assessment of sort of your overall stress response. So yes or no to all these questions. So question 1, I consider myself to be a healthy and well-balanced individual. I engage in some form of exercise at least 3 to 5 times per week. I eat nutritiously with my health in mind. I have a community support system in place that I can rely on, and others feel they can rely on me. I take time to myself each day in some form of meditation, prayer, journaling, relaxation, or silence. I'm able to manage my daily schedule in a way that is productive and fulfilling. I am connected to a higher purpose in life. I am able to engage in the news of the world without being consumed by it.
Important today.
Yeah, very important today. Yeah. I'm able to listen to and respect other viewpoints, even if they are different from my own. I am able to effectively manage my emotions so that I'm not blowing up in anger, frustration, sadness, or resentment. I am able to create healthy boundaries in my life. I am regularly able to get outside to walk, play, or just enjoy nature. I feel responsible for my life rather than feeling a victim to life circumstances. I am easily able to feel compassion, forgiveness, and understanding of others. I feel energetic and focused each day. I get the proper amount of sleep each night. I am able to manage my finances properly, and I have money saved for emergencies. I have creative hobbies that I enjoy on a regular basis. I give back in service to others, either financially or with my time. And I enjoy daily laughter and connection with others. So I'll get you to tally up how many yeses you answered. I'll give you a minute for that. So if you received a score of 20 out of 20, you're living a very well-balanced life and you're able to handle your stress effectively. If you scored 15 to 19 out of 20, you have times when stress can get to you. If you scored 10 to 14 out of 20, stress seems to be a recurring factor in your life. You may find that you experience anger easily, or often tired and experiencing physical symptoms. So addressing stress management techniques might be a good idea. And if you scored 9 or below, stress is a major factor. You would likely benefit from some stress management strategies in your life. So we're going to talk about some of those as we move forward.
Great. So I want to talk a little bit about the different types of stress. And one of the things that you're going to keep hearing me say in this presentation, because I think it's so important to remind ourselves of, is that stress is perceived. Okay, so I have an identical twin who we might be put in the same situation where I might be incredibly stressed and she may not be experiencing it at all. And so I think sometimes having that framework that it's perceived, it's individualized, allows us to have a little bit more control over it than allowing it to control us. And so just something to sort of keep in mind. So the different types of stress that we have survival stress. So you have all probably heard that fight or flight response. This is that, there's, always give that example. There's a bear and I've got to run. Well, in modern day life, what we're looking at typically is, well, maybe I'm driving my car and somebody's going to hit me and I have to slam on my brakes and swerve and okay, so I get that big surge of adrenaline, my heart rate goes up, I have that fight or flight response. We don't experience that all the time, right? What we experience more so is internal stress. And so internal stress is a stress that we put on ourselves. It's the worry. It's the focusing on what I always tell my patients. It's the focusing on the what if, not the what is, right? So we're already steps ahead about what's actually going on. So we're internalizing and creating all this turmoil within ourselves, which is that internal stress. Environmental stress is the stress of our environment. So it could be things like noise or crowds. It could also be pressures from work or family, like how our environment is influencing us. And then we have fatigue and overwork. And this is caused by working too hard, working too many hours, feeling burnt out. And so this is something that I think a lot of us experience, and something that I've been talking a lot to my patients about right now, because the boundaries are so blurred with so many people working from home that I think a lot of people are putting in more hours if they're still working because there's not as much going on, and their office is just off their main floor, so they're really burning the candle at both ends and really overworking themselves and trying to remind themselves it's a stressful time. You have enough stress coming at you from other places. You don't need to spend too much time with the work stuff. So those are types. Here are some different sources. So again, a reminder, stress is subjective and individualized. It comes from our collection of memories, events, learned behaviors. Like, it comes through all sorts of different stuff. But it could be, worry, anxiety, fear, late nights, bills, debts, pressures, our physical stressors, headaches,
Pandemic.
all sorts of yeah, right, yeah, big one. Today's current situation. So lots of different things. And so we start to get signs and symptoms when we experience chronic stress. So we're going to speak mostly about chronic stress, because I think that's what most of us are dealing with. An acute short-term stressor, you got a short little deadline, is not, that kind of comes and goes. What most of us are dealing with is that heightened stress for longer periods of time. And this is when we start to get symptoms. And so we're going to talk about this, but, sleep, this is one of the biggest ones, like sleep problems. And so it can be difficulty falling asleep, or more often what I see with my patients who have chronic stress is it's an inability to stay asleep. And so they wake up either often and they're very restless, or they wake up between 3 and 5 a.m. They wake up just enough to be like, oh my God, I'm so alert. But they look at their clock and go, shoot, if I wake up now, I'm going to be so tired, come the afternoon. And so there's that 3 to 5 a.m. wake up, which happens a lot of times when our cortisol, which we'll talk about, is our stress hormone, is out of balance. Difficulties with weight, so weight gain, weight loss, we can't lose weight, hormone dysfunctions. We'll start to see issues, sometimes thyroid imbalances, or different things like that. We can get the anxiety, the heart palpitations. We have a hard time concentrating. A lot of times my patients will describe it as like just this brain fog, or they'll go when they try and do this task at work, and they're like, I feel like I'm doing a million little things and I can't just see one task through, like they're just all over the place. And so a lot of times these can be rooted in our stress response.
Let's talk a little bit about sort of what is driving this from more of a physiological perspective. So we have our adrenal glands, which are 2 little glands that sit on top of our kidneys, and they're responsible for our stress response. They get their name adrenal because they will produce adrenaline. So they're the ones that will produce that adrenaline, which is that sort of fight or flight hormone. So, I see a bear coming at me, or, you're almost going to get hit by a car and you swerve and you get sort of that gut reaction. That's adrenaline that's sort of flooding through your system, and our adrenal glands will produce that. But they will also produce cortisol. So cortisol is that long-term stress hormone, and these glands have been designed similar to sort of anything in our body. They're designed to work on a short-term window, and if we use them all the time, and if we have cortisol flooding through our system all the time, they will become overwhelmed, fatigued, and exhausted. And what that translates to us is we feel overwhelmed, fatigued, and exhausted. So we will get some of the signs and symptoms when these glands start to not function as optimally as they can. In practice, this is something that we will assess on patients. So this is a adrenal function graph. So this is something where we will assess somebody's cortisol levels. So it is a salivary test that we have patients sort of like spit in a tube at different times. We send it off to the lab, and then we'll get a representation of sort of what their cortisol function is looking like. So you can see the green zone represents the normal range. So it's normal to have sort of a spike in cortisol first thing in the morning, and that's our wake-up hormone. That's what gets us up. That's what gets us feeling alert, and then it naturally comes down during the day. Cortisol and melatonin have a bit of an inverse relationship. So when one is high, one is low. So in the morning, cortisol should be high, our melatonin should be really low. And at night, the reverse should happen. Our cortisol should be low and our melatonin should be high. And melatonin's role is to put us to sleep. So if people are feeling very stressed out and they have lots going on and their cortisol levels are all over the place, sometimes they can have cortisol riding high late in the evening. And these are my patients who are like, I can't fall asleep. I'm just wired. It doesn't matter what I do. I can't fall asleep till 2 in the morning. And it's because cortisol is riding really high at night, impeding their ability to secrete that melatonin. The other thing that we'll see when we talk about sort of sleep dysfunction that can happen with stress is sort of that 3 to 5 a.m. or sometimes 1 to 3 a.m. wake ups, where that cortisol, instead of spiking between sort of 6 or 7, where we want it to in the morning, it's spiking at 5 in the morning or 3 in the morning or 2 in the morning. And then that's where people are like, I'm so awake, I could start my day. So this is, these glands will get dysfunctioned over time if we are constantly utilizing them. So really important to make sure that we are managing that stress response. And we'll talk about that as we go.
So there's different phases of adrenal fatigue. So adrenals, like we mentioned, that's a little gland that produces cortisol, your stress hormone. And so we have three different phases that we can go through. So the alarm phase is a lot like that fight or flight response. So it's that I have an acute stressor. I'm in my car, someone's going to hit me. I'm going to have all of that adrenaline response. So what's going to happen is my heart rate might go up. I might start sweating. My breathing rate increases, but it's all very, very short-lived. And so, you know, it goes up and then it often comes back down. And so most of us don't deal with that quite so much. What we deal with is that that resistance phase, which is essentially when our cortisol goes up and it just stays up. It just stays up because of chronic stress. And so what we end up getting here is a symptoms of elevated cortisol. And this is when we can often feel, like Natalie was describing, that we're tired at night, but we're wired. So we're tired, but wired. We might have anxiety. We might have heart palpitations. We just might feel on edge, irritable. And we can hang out here for a long time. We can deal with chronic stress. Our body's pretty good at it. We can deal with it for weeks, months, sometimes years, before our body just can't spit out that much cortisol. And so what ends up happening is that our cortisol levels drop, our adrenals get tired. And so we start to produce very little cortisol. And this is when we start to get into that exhaustion phase. And so it's named that because one of the main symptoms of this is exhaustion. People are very, very tired. This is that burnt out feeling. We might be a little bit depressed. We might have no sex drive. Ironically, we can sometimes have insomnia during this phase as well. We just feel we can't recover from exercise very well. We work out and we're like, oh, I know it's so good for me. I'm supposed to do it, but I'm so tired after. Our body's just really burnt out. And so we see people at different stages of these, usually in the resistance or exhaustion phase, and trying to really manipulate or improve their cortisol levels to get them back to essentially feeling like themselves again.
So let's talk about, oh, sorry. You done?
Nope. Yep.
Okay. Let's talk about cortisol and its impact. So cortisol, as we said, is produced by our adrenal glands. Short-term cortisol is a really good thing. It's protective for our body. It has some good physiological benefits. But long-term, it can lead to a host of hormonal imbalances. For a lot of women of sort of reproductive age, we will start to see, if cortisol is riding high, we'll start to see a drop in progesterone levels, which becomes really important when women are trying to conceive, or if we get a drop in our progesterone levels, which is dominant in sort of that second half of our menstrual cycle, we'll start to see PMS symptoms, hormonal imbalances, mood swings. This is where women are like, I see this a lot in practice. Patients will come in, they're like, I feel good for 2 weeks of the month, and then I feel awful for 2 weeks. And it's that dip in progesterone that they're getting because of an elevation in cortisol. So it does have some implication and some role in terms of balancing out the rest of our hormones. It can cause more cravings. Some people will get either sugar cravings or salt cravings when their adrenals are out of balance. It causes abdominal weight gain. I see this a lot in the perimenopausal time when I'm dealing with patients. They'll say, you know what, I used to always carry my weight in my hips and thighs, and now I'm starting to carry it in my abdomen. And cortisol tells your body sort of where to store fat, and it will make you store it more in the abdomen than sort of in the hips and thighs. It affects our sleep, which we spoke about. So either that hard time falling asleep, or sort of that waking up in the middle of the night and unable to fall back asleep, or just kind of frequent waking throughout the night. It affects our memory. So that brain fog aspect, our patients just feel like they're in a bit of a fog. I'll see this in patients and I'll say, oh my gosh, I have to write everything down. If I don't write everything down, it's gone. If I lost my phone, I'm lost. And it's sort of that recall that sort of, you know, you're like, or you see somebody and you go, oh my goodness, I can't remember that person's name to save my life, and I know them so well. It's sort of that ability to sort of recall that short-term memory or long-term memory. Fatigue, and also will cause low blood pressure and dizziness. So our adrenal glands are responsible for maintaining our positional change in maintaining our blood pressure when we change positions. So I'll see this a lot. I'll suspect that there's adrenal imbalances when I'm dealing with a patient, and I ask, you know, do you get dizzy a lot? Like particularly if you're, you know, gardening or bending down and then stand up too quick, like you see stars and you have to hold on to something. And it's because our adrenal glands are responsible for maintaining that change in, when we change position, maintaining our blood pressure. So this is something that I think is interesting. So this looked at stress and weight. So they did a 2-year study with 2,800 working adults and showed a wellness program that targeted stress management reduction in the workplace, reduced weight more so than dietary dietary changes. So hugely impactful, that stress has a huge impact in terms of our weight. And I see this a lot in practice. I'll have patients coming in and they're eating so clean and they're exercising and they're doing all the right things. And I go, you know, you should be losing weight. I'm not sure why you're not. And sometimes when we start to dive into some of the stress response, we can see that stress is elevated and that cortisol is impacting their ability to lose weight.
Because cortisol is so connected, I also wanted to talk about more about its influence on sleep and weight. So we need ideally a full 7 to 8 hours of restorative sleep a night. And so usually if I'm in front of people, I'll have everybody raise their hand and say, well, how many of you are getting that? And it's always, you know, there's only a small handful of the room that's usually putting their hands up that's saying, yeah, I actually get a full 7 to 8 hours of restorative sleep. The reality is most people are getting a lot less than that. And 1 hour less of sleep per night stimulates cortisol. So it creates that stress response. It's a stressor on our body to not be sleeping as much. And so higher cortisol does a couple of very interesting things to our metabolism. It inhibits leptin, which is the hormone that makes us feel full, so we feel hungrier. We make less serotonin. Serotonin is our feel-good, happy brain chemical. It's one that all the antidepressants and a lot of the anti-anxiety medications are geared towards. So, you know, we're kind of feeling a little bit more bummed out. We're not making as much of that. We make less growth hormone, so our muscle mass often is lower. And we make more ghrelin, which is the hormone that makes us feel hungry. And so there's this whole change in our metabolic processes that start to happen. We also, it also affects our insulin response. So it makes us more susceptible to prediabetes or diabetes. So sleep is hugely important, not just in terms of how we feel in terms of energy, but also, and also just in terms of our weight management. I like to talk a little bit about this because I think we've all been told, you know, you need to eat often, right? Everybody, well, a lot of people have been told, you know, you wake up and you start breakfast because you got to get your metabolism going and make sure you eat every 2.5 to 3 hours, keep your metabolism revved up. And so I'll often see people in practice who are like, I'm doing this and I'm gaining weight, or I'm doing this and I'm not losing weight. And I think the story is that if it's not working for you, it's not working for you. It works for some people, but it doesn't work for everybody. And I like to talk about this because I know it can be really frustrating for people that some people, and namely people who have issues with their hypothalamus pituitary adrenal axis, but basically what that means, people who have issues with stress, don't typically do very well eating all the time. If we want to lose weight and we're somebody who has issues with our cortisol, we actually do better with periods of fasting. And so you've probably all started to hear a little bit about intermittent fasting. That's where people eat only in 8 hours during their day and they fast for the rest. That's one strategy that can work for some people. But sometimes what I'll just have patients do is I cut out their snacks. Like, stop snacking, eat 3 times a day. Go back to the way that we used to tell people to eat. Stop eating between. And often not even eat less. If they're eating the right foods, I'm like, sometimes you can just get away with eating the same amounts, but just having it at 3 times throughout your day and having bigger gaps between your meals. And so sometimes that's all it takes for some people. And so I like to mention that because I know that there's a lot of misconceptions about diet, but I think snacking is one of them that we've often been programmed to think that we're supposed to do. And sometimes it's not right for everybody.
Oh, am I going to be able to show this? So let's see how good this works. So I want to show this video that is a cool little, oh, can you guys see my screen still? Can you see my screen, Nick?
I'm not on that mode. Hold on.
I can see the PowerPoint presentation still, but not the YouTube link.
Oh, how do I share the YouTube link?
You might have to click on share screen and then click on the YouTube video, but I'm not entirely sure.
Okay, maybe we just go back to what we were doing before I got too fancy here.
Yeah.
Okay, well, I'll leave that in you guys are going to get access to these slides, so you can always watch that. It's a cute little video that sort of describes the impact of stress on your body. It's sort of a quick little 1-minute video that you can watch.
Okay, so that's a little bit about, you know, everything about stress and what it is and how it affects our body and what's happening. And I hope after that little introduction, you have an appreciation for how many things it touches in our body and how many systems it affects in our body. And so what we want to do now is sort of switch gears to that. Well, now we told you the bad news, so let's tell you the good news. Like, what can you do about it? And the good news is there's a lot that can be done. So we start to look at some of our different naturopathic treatments. These are kind of the tools that we have, and we'll dive into them a little bit. So I think nutrition, I'll sort of pass over to Nat, but this is a huge part, a huge, huge part.
Yeah, so nutrition is something, and we'll dive into some specifics and things that we can do from a nutrition perspective. Lifestyle counseling is really helpful. Botanical medicine, so that's using herbs. Acupuncture, which obviously we can't do right now, but is one of my favorite treatments in practice. I quite enjoy that, and I think it's a great opportunity to sort of help people pause and connect to their body and just sort of relax. Homeopathy, physical medicine, and we're going to dive into sort of all of these. So let's chat a little bit about diet and what should your diet look like. And I always say, when there's so many stressors around us, let's control what we can control. And our diet is one of those big things that we have the power to make some changes, and we have the ability to control this piece. So, there's so much going on in the world right now. We can't control lots of what's happening, but we have the ability to focus on our diet and make sure that we're eating nutritious food. So avoiding stimulants is really key. So if you are an anxious person and you know that about yourself, maybe avoiding coffee or decreasing your coffee or switching to a decaf coffee. But coffee is a nervous system stimulant. So I always say if your nervous system is already overstimulated, this is something we might want to avoid. We want to eat nutritious meals, so meals that are easy to digest, non-processed, whole foods. I know it's challenging right now because most people are doing their grocery shop once a week, which most of us are sort of not necessarily used to. So we're typically doing sort of a big grocery shop and having a meal plan for the week. But maybe just taking a few extra minutes to sort of write out your diet, write out what you're going to eat, so that you have a bit of a plan in place that includes lots of healthy foods. Avoiding refined sugars. For a lot of people, this can rev up that stress response and sort of rev up their anxiety. Making sure we're staying hydrated. Eating slowly and mindfully is really important. Most of us are, eating in a rush when we're stressed out. We just gobble our food down and we don't take any time to, help our bodies digest, get into sort of that rest and digest nervous system and allow our bodies to digest that food appropriately. And avoiding your food sensitivities. So food sensitivities, I'll talk about this a little bit after as we go.
Okay, I think, there's a lot of noise around nutrition, right? We're always told, eat this, or this is a new diet, and try this and try that. And you meet somebody and say, well, today I'm keto, or I'm vegan, or, I'm gluten-free, dairy-free, I'm intermittent fasting. Like, there's so many different things. But I think the big thing is just really listen to how you feel. Listen to how you feel after you eat this big piece of pizza. Do you feel great, or do you feel sluggish and tired and bloated and just feel like you want to just kind of go to bed and, lie down and don't feel that motivated, right? Versus when we eat a lot of colors, when we eat a lot of colors and we eat a lot of foods that are from nature and, things that were once alive, we usually feel that way. We have more energy. We feel more vibrant. Our digestion's working better. We're just fueling our body with the nutrients it needs. I know taste buds are, an important part of eating, but so is like, what is this providing me? What nutrients is this providing me to do the processes that I need? And the reality is when we're under stress, we burn through our nutrients so much quicker. And so we need more nutrient dense foods. It's better for our body to eat foods that are rich in nutrients so that we can replenish the depletion that has happened. We do a lot of IVs in practice because we're just trying to replete what people have lost, we're trying to get them back on track and then, back to feeling like themselves again. But, if we ate well in the first place and we were mindful of this, which I recognize when we're stressed, sometimes the first thing that goes is our diet because we just don't have as much time. And so we'll reach the quick or grab and go stuff. And I often tell my patients, well, it's not so much now because most of us are eating at home, but when we're back out and we're back into a busier time, you can make wise choices when you're out and about. You can just have to pick wisely. They're there. You just have to look for them.
And then sort of listening to your body a little bit when it comes to which foods fuel your body really well and maybe which foods are hindering your body's performance. There are some common food sensitivities, and I always tell patients, not everybody has food sensitivities. Not everybody needs to give up gluten. We hear about that. Some people do quite well on it, but I think it's really important to sort of listen to your body and listen to how you feel. If some foods are making you feel tired and sluggish and bloated and affecting your digestion, or maybe you have lots of aches and pains, or you have a lot of inflammation in your body, these foods can really trigger that for you. And it's not going to be all of these foods for everybody. It's going to be one of these foods, two of these foods, combination of these different foods. Even myself and Nicole being identical twins, we have different foods that, different food sensitivities. So different foods that I don't do well on and different foods that she does, better on. So, it's quite unique in that sense. But this is just going to be sort of a physical stress on your body. So when we are trying to sort of look at our diet and control the pieces we can, we want to make sure that we're lifting any of those sort of physical stresses from our body. And when we're eating well for our body, we're going to absorb those nutrients more, which Nicole spoke about being really important when we are under a lot of stress. This is something we'll do in practice for patients who are curious about their food sensitivity test, or food sensitivities is a food sensitivity test that we can run that is a blood test that will then just sort of take the guesswork out of it. But I always tell patients, I can save you a lot of money and just pull the food out for a couple of weeks. So I just tell patients, if there's a food that you suspect is an issue, or if you're not sure, write out a diet diary, write out sort of a symptom journal, see what you're noticing, and maybe there's something that you're noticing the day of, like that symptom arising, or the couple days before that you're consuming the same food, and then just pull it out. Pull it out of your diet. I have a lot of patients who say, I don't want to do that. That's too hard. So then we run a food sensitivity test. But, I love sort of the good, basic, old school approach to just sort of pulling the food out, see how you feel, and then add it back in. If that symptom comes back, we know that it's a food. So it can be really simple.
So sleep. So this is one of the things that I think gets affected very regularly when we're under stress. This is something that I'm talking to my patients about all the time. And I think it's important to create the right space for sleep. So, you've heard some of this stuff before, but we need to have the right sleep hygiene. So we need to have, try to go to bed at the same time every night, wake up at the same time every day, create consistency and routine for our body, allows it to de-stress, right?
Especially
our body
right now with
yes.
everything that's going on, people are sort of lacking that routine.
Yeah, people are staying up later, they're sleeping in a little bit, there's no routine. And that's a good point. I've been talking a lot to my patients about that the last month or so. With I think when this all started, none of us were really aware of how long this would go on. And I think now that I think it's week 6 we're into now, this is it for now, right? So I've been telling them, you have to create your new structure, your new routine for now, so that our body can stop feeling stressed by the inconsistency in our patterns and our routines. So if we can get a really consistent bedtime and get a really consistent wake up time, that can be really helpful. Avoiding screens. Screens are horrible for our sleep. They prevent our body's ability to release melatonin. Melatonin is the hormone that puts us to sleep and keeps us asleep. And so if we're on a device right up until bedtime that is going to prevent our body's ability to make melatonin, and we have an issue with cortisol, which is already preventing our body from making melatonin, we're not making a lot of the hormone that's going to help us to get to sleep. So trying to be mindful of staying off of our screens at least an hour before bedtime. There are some cool settings on phones and stuff now, or you can buy like blue light blocking glasses that you can wear, and you can put a nighttime setting on your phone, which just helps to minimize the type of light that affects melatonin. So there's some innovative ways that we can do this, but I still think the stimulation from a phone itself is also not the most calming, because many people are, going on social media, reading all sorts of articles, or checking their email, which is raising stress. And so I think disconnecting from screens before bed is really important. Having a really dark room. So the darker your room, the darker your environment, the more melatonin you're going to produce. And so, room darkening blinds, or it could just be a simple eye mask. I'll get my patients just to put an eye mask on before they go to bed if their room's not incredibly dark. And that can help our body to produce more of that melatonin. Having a routine before bed. We do this a lot with kids, right? I've got a 1-year-old and 4-year-old, and it's always like, okay, well, it's bath, book, bed. This is what we do. We unwind, we get your body to get ready for sleep, but we don't really do that as adults. We just keep doing all the chores around the house, or doing all the stuff. And then it's like, or watching screens. It's like, now it's time to wind down. And then we get to bed and we're tired, but wired. Like our brain is going and we just can't calm down. And so sometimes adopting some of those strategies that we do with kids, and having some sort of consistent pattern or routine. So it could be, it could be a bath, and it could be, reading in bed, and just doing some really non-stimulating things. I'll often get my patients to, when we're having a hard time falling asleep, get them to meditate before bed. They do a progressive meditation while you're in bed. you know, just do some sort of guided meditation, listen to somebody else so that your brain doesn't start to kick in. But just really try to unwind the body and bring it down can be quite helpful. This is just talking a little bit about weight loss as it pertains to sleep. So again, just showing the difference between, this was 1,000 participants. And so people who slept 8 hours a night versus those that slept 5 hours a night. Well, their body mass index was elevated. So the body mass index is your weight to height. So essentially people were heavier. Their leptin was lower. That's the hormone that makes us feel full. Their ghrelin was higher. That's the hormone that makes us feel hungry. And so all these things start to, you know, make us have cravings or you know, wanting to snack on things. And sometimes I have patients say, oh, you know, it's just my motivation and I just can't stick to it. I'm like, no, it's your hormones. It's your hormones. We got to get you sleeping. You got to prioritize your sleep. It's going to make a big difference in terms of how everything else starts to balance itself out.
So let's talk about some more stress relieving techniques. So one favorite is exercise. So all exercises releases endorphins, which are your feel-good hormones. So for most people, after they do some kind of exercise, they feel a whole lot calmer and a whole lot better. Exercise also decreases the risk of developing chronic disease due to stress and decreases overall mortality. So if that's not reason enough, I think that that's pretty powerful. There is so much out there right now. Everybody on the online space is offering free workouts. Whether, you know, you just need to look for something, and there are so many options out there. And, you know, a lot of times people now have the luxury of a little bit more time. So if we have a little bit more time, I've been encouraging my patients right now to develop some of these healthy strategies so that when life does go back to whatever our new normal is going to look like, we already have that in place. So I think it's a really great opportunity to build in a new habit. Yoga is great if you're feeling really stressed. So it incorporates sort of that breath with movement. It builds awareness of how your body's feeling, and it ties in that mindfulness. So I love recommending yoga to patients who are like, I can't meditate. I can't just sit there. I can't do nothing. It sort of allows you to get into sort of a little bit more of that meditative state and that calm state with movement. So I think it's a really great exercise to adopt. So mindfulness. So mindfulness is so, we hear this a lot. It's a little bit of a buzzword, but it's being mindful of being what's aware around you, like being aware of what's around you. So I always say, you know, mindfulness can happen in anything you're doing. Going for a walk in the woods, instead of sort of plugging in with your earphones and being distracted, it's sort of just like opening up your mind and your sound and your sight and listening to the birds, feeling the wind, taking in those moments. So it's just sort of being present in your body. And I've been talking a lot recently about sort of this opportunity we've kind of all been given for this, what I've been calling like a great pause. Like we've been given sort of this great pause on life right now. Like everything is shut down. We can't go anywhere. Everybody's stuck in their homes. We're with our families. But I think it's a really unique opportunity for people to evaluate what is serving them in their life and what is not. And I think it's a really great opportunity to evaluate, like, what do I love about right now? Do I love having family dinners every night? Do I love that we're playing board games as a family? Am I loving the connections I'm making with friends, that we're, you know, talking more, or, you know, whatever it is for you. And it can be so simple. It can be just like, you know, I love that I'm having an evening bath every night. I love that I'm, whatever that is for you. So just finding some of the things that you're sort of grateful for, and some of the things that you are enjoying right now. And then evaluating sort of like what old life looked like, and saying, you know, like, do we really need to have such a hustle and bustle morning? Or why is my kid in 14 activities? Why are we doing all of these things? And sort of just evaluate it in sort of this pause, and maybe just sort of this mindfulness piece right now with kind of this unique opportunity we've all been sort of handed. This was a YouTube link, but I'm not going to do that. I will encourage you guys to, though, once you download the slides or you get access to the slides, to go to this. It's a 2-minute deep breathing exercise. And oftentimes when we do presentations in person, I will play this, and I'll get everybody to go and do a 2-minute breathing exercise. And it is amazing, sort of the energy shifts we'll feel in the room, and the changes that people will notice in their body, and just how much calmer people will feel afterwards. And that's 2 minutes. That might even be 90 seconds. It's nothing. So this is what I'm encouraging people to do, is just sort of get more consistent with whatever sort of mindfulness, deep breathing, but this is powerful stuff.
I think it also, what I like about it is the deep breathing is that it takes it back to you. You know, what can I do to overcome the stress? What control do I have over this? And if you have these tools in your back pocket that you've learned, mindfulness, deep breathing, whatever that might be for you, you can always do that. You know, so when you're feeling overwhelmed or you're feeling stressed, you just take a little time out, you do 90 seconds of deep breathing, center yourself, ground yourself, and kind of return to what you were doing. And I think when we talk about all these sort of lifestyle things we can be doing for stress, I think it's also important to recognize what's an actual stress reliever versus what's just distracting us. And so sometimes when I ask patients in a first visit, you know, well, what's your stress relieving activity? What do you do? What do you do to manage your stress? Oh, exercise. It's the most common answer. Exercise. Well, I exercise. I've got a great exercise program. Okay. Do you truly feel calmer after the activity than you did entering it? Or do you feel the same? Were you just distracted for 60 minutes? And sometimes the answer is, oh, you're right. I forgot about it because I was focusing on the instructor or my workout or the treadmill. And so, you know, they're just as stressed when they left. I'm like, well, then that's not your stress relieving activity. Your stress relieving activity could be, you know, having a cup of tea by yourself. It could be, you know, the pleasure of just reading. Like, it doesn't have to be anything overly elaborate. It could be 90 seconds of deep breathing. And I think just experimenting with a few different ones and then just seeing what resonates with you is really important and powerful. I'm going to talk about a couple of herbal supplements and a couple of things that I'll use in practice. I will preface this by saying that I certainly don't put people on all of these. There can be a lot of drug-herb interactions. So if you're on any medications, don't just go grab anything at a health food store. Make sure that you've run it by somebody. But the first few are a bunch of what we call adaptogens. So adaptogens are herbs that help our body to adapt to stress. I use these all the time in practice. These are probably, this class of herbs is probably my most prescribed thing in practice. It is a way of adapting our cortisol response. So if our cortisol is high, some of these herbs can help to bring it down. And if our cortisol is low, some of this can help to bring it up to the point that we need it to. And so they're really, this medicine can be very powerful for this stress response. So rhodiola, withania is my favorite when we're like tired but wired. Licorice is, you know, when we're sort of just really tired and we need a really good balancer to our adrenals. Ginsengs can be very energizing. St. John's wort I use a lot when there's mood issues. So when somebody's feeling down or depressed, lots of drug interactions here though. Valerian, passion flower, lavender has become very quickly one of my favorites. And so different herbs that we can use for sometimes before bed to help with sleep, and sometimes in the morning to help regulate that cortisol spike that we might be experiencing in the middle of the night. So we might dose these at different times, but there's some herbs that can be very, very helpful and powerful. Vitamins and minerals, we've already talked about how we can be very depleted when we're under stress. And so the nutrients that particularly get depleted is vitamin C. You've heard a lot about vitamin C, I'm sure, in terms of immune function right now, but from a stress situation right now as well, stress depletes our vitamin C. Our adrenal glands require a lot of vitamin C. B vitamins, notably vitamin B5, is something that really helps our body to deal with stress. So I'm often putting people on these to help essentially replete them. Magnesium is, I think, probably one of our most prescribed things in the clinic. We use it for a ton of hormone imbalances, but it's really calming. It's really relaxing. It's great before bed to help to get people to sleep and keep them asleep. We always talk about calcium being the mineral that most people need, but the reality is most of us need magnesium over calcium. Hands down, most of us are deficient in magnesium. We burn through it when we're stressed. GABA is something, it's an amino acid. It's very calming. 5-HTP helps our body to make a bit more serotonin, so it's great for moods. L-theanine is also really calming, and I'm sure most of you have heard of omega-3 fatty acids. They can be great for hormone balances. Other stress relieving things. So acupuncture is something that can be very powerful for this. For just the points can be very calming that we could use, but also B, I think sometimes the part of the therapy is the fact that you're lying still with needles in you for 30 minutes, and so you can't go anywhere, and you're really forced to relax and unwind, and then you have this extra benefit of the needles actually having an action on the body. Massage therapy or any sort of body work, and this could be a an RMT, like a registered massage therapist. This could be your partner, your friend. I think touch, you know, and certainly right now we're not getting often quite as much of that, but this can be a really calming and grounding and comforting, I think, for a lot of people.
And for people for my patients who are, you know, haven't obviously been able to do their massage therapy or sort of their physical therapies, I think turning to, you know, like foam rollers and stretching and yoga and things that you can do at home to sort of calm that body down and sort of calm that stress response is really beneficial.
And so I think, you know, when we talk about stress and we talk about the influence that it's having, and hopefully we've given you some tips and some things to that you could implement today to start looking at, you know, what changes could you be making in your life, or what different things could you be reflecting on. I think one of the first things is what Natalie talked about, is identify the stressors. And I think now more than ever, we have the perfect time to do that. I know obviously the pandemic is a big stressor in itself, but a lot of life has changed. And so it is that big pause. It is that opportunity to look at what's serving me, what's not serving me. Where is my stress coming from? How do I, you know, can I rid that of my life? Is that not something that I need to reintroduce when the time comes? And so really an opportunity, because step one is always identify what the cause is. And so no matter what we're treating, we always want to try to get to a root cause. And if stress is a root cause, well, we want to try to, you know, you can't out supplement something if you're just going to be exposed to it, right? So we want to try to minimize some of the stressors as best we can. And so, you know, identifying what they are. Trying the breathing exercises. So unfortunately we couldn't do it tonight, but when you get the slides, I really encourage you to do it. Try doing some deep breathing and recognize what kind of response that creates within you. The third one, remember that stress is perceived. So this is something that I like to really emphasize, and I said it a couple of times tonight, because it's individualized and perceived. It puts the onus back on us having control over it rather than it having control over us. And so if we can stay in that position where we are able to see it differently or make the changes necessary, we can lessen that, right? So something to remember. And I would say, don't be afraid to ask for help. You know, whether that is, you know, dealing with you know, talking to different people about it, reaching out to professionals, you know, talking to your boss about it, whatever it might be. Just, you know, everybody's experiencing this. This is not a unique thing for one person. I think everybody, I've not met a person in my practice that I've not asked, oh, maybe other than kids, do you experience stress, or how would you rate your stress? And nobody has ever told me 0. I've never ever gotten a 0 out of 10 when I ask them, you know, to rate their stress. And so we are all experiencing this. And so I think there's a lot of comfort in knowing that all of us are experiencing, but also that it's okay to ask for help or to make change or do those different things. So something to reflect on.
Awesome. So yeah, I think that's all we wanted to sort of formally discuss tonight. But I saw that the chat was sort of popping up with some questions. So we will, I guess, get Jessica to help us sort of moderate some of those questions. Yeah. And I put on here, if people, we're pretty active on our Instagram and Facebook. So if people want to sort of stay up to date with some health tips and things, you can follow along there. And our email addresses are there if you have any questions.
Perfect. So the first question Becky is just posting is from Robert about sleeping well at night. He's tried everything he can think of, thoughts or suggestions. So I think this was at the beginning of the presentation, and you did talk about that throughout the presentation. So I don't know if you could just summarize like your top couple tips to sleep.
I think it comes down to the environment. First and foremost, so you got to look at what you're sleeping in, what it looks like, what your room's like, is it dark enough, and really looking at that piece first. And then looking at the stressors, looking at the routines, really getting the hygiene piece in place. I think yeah.
And then I guess there would be different recommendations if it's hard time falling asleep versus hard time staying asleep. There can be sort of different things, but I think Nicole's right. When I don't just jump to supplements with patients, I will make sure that sleep hygiene piece is on point, and that can be, and eye mask. Super cheap, easy. Yeah, one of my favorite things that just helps to naturally kick your melatonin. So unless you can, if you have room blackening out curtains, but I always tell patients you shouldn't be able to see your hand in your room at night. There should be no light from an alarm clock. There should be no little dot from a TV. There should be like 0 light stimulation. So either room blackening curtains or an eye mask is one of my favorite things that can do wonders. When we were in real life, I just tell people to go to the dollar store and grab one. I'm sure you can find one online quite easily.
Huh.
Works brilliantly. Yeah.
You had mentioned melatonin, and someone had just jumped in with a question as well with melatonin.
Sure.
Do you take it right before bed or at any time?
Right before bed. So if you are going to supplement with it, you want to mirror sort of our natural physiological release of it, which is right at bedtime. I will use this for shift workers a lot, we need to like mirror a circadian rhythm because their circadian rhythms all over the place, or some of my pilot patients or people who do a lot of work travel. I will have them do it when they should be sleeping. But if you're in a regular routine where you're not changing, well, nobody's changing time zones right now, but just take it at bedtime, right at bedtime when you want to fall asleep.
Perfect.
I will say, if you're having a hard time falling asleep, sometimes I'll have them take it 30 minutes before bed.
Sure.
Just so it's like kicking in by the time you actually get into bed. But
awesome. And so we're still on sleep talking. So how to stop panicking and learn to relax if someone's going through, like with the pandemic, going through divorce, just life situations, how are they able to kind of turn that off and relax?
So I think again, sort of are you gonna go? Go ahead.
No, you can go ahead. Yeah.
Okay, I was gonna say, I was gonna say, a good. This is where we do better in person because I can look at her. And I think a good routine, like a good wind down routine, can be really beneficial. One of my favorite things to get people to do is have an Epsom salts bath sometimes before bed. That can be really, really helpful. And then I'll sometimes lean into some of the supplements and some of the things that we recommended. Just to help sort of calm that nervous system down if somebody needs a little bit of extra support. But an Epsom salt bath is great because it's magnesium salt. So it's sort of one way of absorbing the magnesium, which can be really calming.
I was also going to say that one of my favorite tips for that too is the guided meditations before bedtime or at bedtime. So your mind doesn't have an opportunity to focus on all those things. You're focusing on somebody else talking to you that's trying to calm you down. And so a lot of times I'll have patients download, the Calm app or, I don't know, so many of them.
Headspace, another really great app that I like.
There's a bunch of free meditation apps.
Insight Timer, there's a whole bunch. Calm is one of my favorites. Insight Timer is really good, and Headspace are sort of three that I oftentimes will recommend. But those can be really powerful tools.
Great. Talking about working from home. So Isabel's saying, I work from home. I suffer from anxiety disorder with impending feelings of something is going to happen. I have a very high degree of stress. I need to function daily since I'm working right now. And I think that touches on a lot of people.
Big time. Yeah, big time. Yeah.
Yeah, there's a lot in that question, I think.
Yeah, I wasn't sure what the question itself was, other than sort of a statement that I think a lot of people are feeling, and I think you're not alone in sort of feeling that. I think that's a big reality of sort of what's going on. I think I've been talking a lot to patients about taking news breaks. So let's turn off the news. If you know that that's a trigger for you, turn it off. Don't watch it. I haven't watched it in a week because I'm like, nothing good's happening here. If it's big enough news, I'll hear about it. There's a big change in what's happening in terms of our social distancing. Somebody's going to tell me, but certainly sort of taking a break from that, particularly before bed. If you're having a hard time falling asleep, I would definitely encourage people to take a little break from it because I think that can be really beneficial. Adding some exercise might be really helpful just to help release some of those endorphins.
I think also just reaching out to health professionals. So whether that's, your medical doctor or whether it's a naturopathic doctor, a lot of people are doing virtual consults. So people, as much as it's not going into an office, a lot of times that you can still get the care and help that you need if you need more than just some of those recommendations.
Perfect. There's a question about setting boundaries for stressors like family relations and managing irritability, which I think is a big one right now when everyone is in close proximity to each other.
So I say prioritize sleep. Like just get your sleep. I always say it's amazing what we can handle in terms of stress if we're well rested. We're sleep deprived, and it can make a huge difference in terms of our how short we are, how irritable we are. And I think also if we're talking about family relations within the household, just trying to have your own space. We're so used to having having our own identity, our own space. We leave the house for 8 hours and go to work, and now we're often all in the same space. So I've been sort of encouraging my patients to like have their place where they go and do work, and then even each taking breaks, and go out for that walk or go get some fresh air, and go do that on your own. Just having that time to yourself, I think, can be really powerful too.
And reach out to your network. I think it's so important to make sure that you're reaching out to your friends and the people you would normally, who would normally be your support system. Like, just because we are distancing doesn't mean that we have to be disconnected. So making sure, you're scheduling some Zoom calls. I have one patient this week, we were chatting about ways that she could connect. She lives on her own, so she's feeling extremely isolated. We were talking about, host a board game night with your friends and just get some board games, do a virtual dinner party with friends, cook with friends. Like, maybe you both do the same recipe together, and just different ways that we can sort of find that connection.
Those are awesome suggestions, 100%. I think even just being able to come to a presentation today has been incredibly helpful for just having it all on a calendar.
Yeah.
St. John's wort reacts with the medications. Which ones? I feel like, is there
Tons.
a
lot?
Yes, too many to
long
list.
Yeah.
It is metabolized through one of our liver enzymes that a lot of our drugs are metabolized through. So it has a laundry list of meds.
So a talk to your pharmacist type
Talk
of...
to your pharmacist, talk to your
Big time.
naturopathic doctor, talk to somebody. Don't just blindly take St. John's wort if you're on a prescription medication.
That's true for all the herbs, and
that is true for all the herbs.
mentioned.
St. John's wort is one of the highest, but that is true for a lot of those herbs, that they will have drug herb interactions.
And then I think the last question that we have is, I use ashwagandha sometimes for sleep, but I've always had strange dreams on that. Is that normal?
On ashwagandha?
Yes.
I don't know. Nicole, do you know the answer to that?
I've seen it only a couple of times.
I haven't seen it a lot, but everybody's unique. I do know that it has a favorable impact in terms of sleep. Like, it will help people get into a deeper, more restful sleep. So whether or not that sparks dreams, I haven't seen that clinically a lot. Have you? And I haven't looked at the research to know for sure.
I've seen it a couple of times in only not even a handful of times, just a couple of patients, and we weren't sure if it was Othania or not. But it is, its name is...
Withania is the same name as ashwagandha.
Ashwagandha is also called Withania somnifera. That's the Latin name. And so somnifera, like for sleep. So it does put people in a deeper sleep often. So with that said, sometimes people will dream more. So we see that a lot with melatonin. Sometimes people get really vivid dreams with melatonin. So I would think it's a very similar... my speculation, what happened with a couple of patients, was it was a similar mechanism. They were just having a deeper sleep, and that's what was happening.
Interesting.
Mm-hmm.
And then, sorry, last question, magnesium. There are many types of magnesium supplements. What does each one do?
They all have different actions. So there's magnesium citrate, there's magnesium oxide, there's magnesium malate, there's magnesium bisglycinate. So they all have sort of different actions.
And more.
Yeah, I just named off 4, but there's more. Magnesium oxide has a very strong bowel effect. Citrate has a bowel and a bit of a calming effect. My favorite one for the nerve malate is a little bit more muscle pain. Magnesium bisglycinate is my favorite for stress and anxiety.
It's about the absorption and how they get absorbed and where they get absorbed and all that.
So more so talk to someone if you want a specific...
Yeah.
Depends on what we're trying to accomplish, essentially. Yeah. Okay. Health risks or general consequences of sleeping more than 8 hours, and go over ways to boost your metabolism. So I think you guys talked about metabolism. Yeah. If you can just a couple of quick metabolism points and.
Yeah, I think metabolism, sleep, stress reduction. Look at whether or not your diet's serving you. I think those are all sort of big things from a metabolism perspective. And if we're doing
assess your thyroid.
If we're doing all those things and it's not working, get your thyroid tested, thoroughly tested. And what was the other part of the question? Sorry.
Oversleeping, of getting more than 8 hours of sleep.
Not always. Sometimes people need more. And so there are some adults that need 9.5, 10 hours, but sometimes it can be a symptom of something else. So sometimes it can be a symptom of depression or low mood. So sometimes we want to look at, why are we sleeping so much? Is it that we're tired and we need it and we feel great when we get a little bit more sleep, or is it a symptom of something greater? And so sometimes I just like to know that, or are we one of those people who just needs that 9 or 9.5 hours, and that's how we just feel better.
Awesome. Well, thank you so much. I think those are all the questions. Huge thank you for joining us on Zoom, for being our trial presentation.
Yeah,
And I think it went really
great.
well. So thank you so much for that.
Thanks for having us.